Assalamu alaikum. I hope you all are good and safe at your homes. Today, our topic under discussion is about pox diseases. And pox diseases, we will discuss first of all sheep and goat pox. The causative agent of goat pox is Capripox virus. Collectively, the infection by this virus is called Capripox infection. The sheeppox is a highly contagious condition. Virus enters through the respiratory tract as aerosol spread, and the virus is present in the nasal and oral secretions for several weeks and live in the scabs for several months. That is why it is important to burn the scabs of the lesions, and spread is also possible through the contaminated material and skin abrasions. Capripox is also transmitted by TZ fly. Coming towards the pathogenesis of this, initially viremia, and then virus deposits in the tissues including the skin and start replication. Then we can find the clinical findings. The incubation period is about 12 to 14 days. One form is malignant and the second one is benign. And malignant form is more common in lamb, and there will be depression, high temperature discharge from the eyes and nose. Infected lambs die before the appearance of lesions, and lesions develop on non-wooled skin, buccal mucosa, respiratory mucosa, digestive mucosa, and urogenital tract mucosa, and sometime under the wool. Papules, nodules, vesicles, and then pustules, and at last scab is formed. Some lesions may progress from nodules to tumor-like masses. Benign form is common in adult animals. Only skin lesions occur, particularly under the tail, and there is no systemic reaction. So here is a picture of infected animal, sheep pox, a generalized lesion affecting the skin but partially hidden by the coat. Here you can see that the nodules are formed. Coming toward the treatment, there is no specific treatment for the pox, and only palliative or soothing treatment can be given to the animal, and from that the ointment and antiseptic wash, and we can use neem oil on the lesion for the soothing effect. Zinc oxide powder mixed in Vaseline can be applied on lesions topically, and parenterally antibiotic can be given to prevent any secondary infection. Now coming toward the vaccine of this cell culture, sheep vaccine is used in sheep pox. It is an attenuated live virus cell culture vaccine, and the strain which is used in it are RM65 strain, and while consists of 100 doses, its shelf life is 2 years, and 100 ml distilled water on or a normal saline is used for preparing this disease vaccine. Vaccine should be used within 1 to 2 hours after preparing, and its dose rate is 1 ml subcutaneously per animal. And the vaccination in first week of March and the first week of September, it is done twice a year. Then the goat pox cell culture vaccine is live attenuated cell culture vaccine grown on prime kids kidney cell culture, and it is safe for pregnant goats. Dose rate is 1 ml subcutaneously with normal saline, and 100 ml distilled water or normal saline is used for preparing this vaccine in having 100 doses. Then vaccine should be used within 1 to 2 hours after preparing it. Now coming toward the cowpox, it is caused by orthopox virus family poxviridae, and the lesions are on teat and udder. Papules are formed with hyperemia around the base, and vesiculation, postular lesions, and finally scab formation. And same, there is no specific treatment for this. The treatment is palliative. You just give the treatment for soothing the effect of the vesicles. Here you can see in the picture that cowpox ulcer on a teat, which is after 7 to 10 days onset of the lesion. Then comes the Pseudocowpox or milker's nodules. It is caused by parapox virus, and there is formation of vesicles, pustules, and thick scabs. Scabs are horseshoe shaped, surrounded by granulation tissue, and it has a zoonotic importance as it can be transmitted to human or milkers. That's why it is called. It mainly transmitted in the milkers who come in contact with the teat of the animal, and during the milking, and it forms the lesions on the hand of that milker, and that's why it is called the milker nodule. And treatment is again the palliative treatment is given. No specific treatment is there. So this was all things. If you have any question, you can ask me in the group or in the chat box.